Okay, good afternoon, guys. I have discussion A for you. We're discussing new Medicare rules could delay your medical treatment. Highlights a major policy shift starting in 2026. Traditional Medicare will require prior authorizations for certain outpatient services in select states. This means that before doctors can perform or bill for these procedures, Medicare must first approve them. While the intent is to reduce unnecessary spending and improve oversight, the change introduces new administrative hurdles that could slow down access to care. What is changing in 2026? Introduction of prior authorization. In original Medicare, historically, prior authorizations has been common in Medicare Advantage plans, but not in traditional Medicare. The new pilot program called Wiser, Wasteful and Inappropriate Services Reduction, marks the first time prior authorization will be applied to original Medicare. Pilot states beginning January 1, 2026. The program will roll out in Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. Targeted services. 17 outpatient procedures are included. These are services Medicare has identified as frequently overused or vulnerable to fraud. Examples mentioned in surrounding coverage include electrical nerve stimulators and other routine interventions that may lack strong evidence of effectiveness. Approval process. Requests will be screened using technology, but a licensed clinician will make the final decision, ensuring human oversight remains part of the process. Why Medicare is testing this? The Wiser model is designed to reduce unnecessary care. Medicare spends billions annually on services that may not improve patient outcomes. Prior authorization is meant to filter out low value or redundant procedures. Prevent fraud and abuse by requiring approval before payment. Medicare hopes to catch questionable claims earlier. Encourage evidence-based practice. The program nudges providers toward treatments with stronger clinical justification, aligning care with the best practices. Who's affected? Beneficiaries in original Medicare, even those with supplemental insurance, Medigap, plans like G or N will be subject to these rules. Since prior authorization applies to the core Medicare coverage, patients in 6 pilot states, seniors in Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington will be the first to experience the new requirements. Providers and clinics, doctors, hospitals, and outpatient centers will need to adjust workflows to accommodate the new approval process, potentially increasing administrative burdens. Practical implications and potential delays. Added steps before treatment. Doctors must submit documentation and wait for Medicare's approval before scheduling or performing the affected services. This could mean longer wait times for patients, risk of denials or slowdowns if paperwork is incomplete or processing lags. Patients may face delays or even denials despite medical need. Balancing oversight with access. While the program aims to reduce waste, critics worry it could create barriers for seniors who already struggle with timely access to care. Preparation is key. Patients and providers in pilot states will need to plan ahead, ensuring medical records and justifications are thorough to minimize interruptions. Bigger picture. The pilot reflects a broader tension in U.S. healthcare, balancing cost control and fraud prevention with patient access and autonomy. If successful, the wiser model could expand nationwide, reshaping how traditional Medicare operates. But if delays prove burdensome, it may fuel debate over whether prior authorizations belong in original Medicare at all. Would you like me to map out which of the 17 services are most likely to affect seniors directly, e.g., pain management, devices, imaging tests, or outpatient therapies. So you can see where delays might be most noticeable. Okay, guys, so that is A for you. I'll be back on shortly with B. Until then, Gator Wellness. Take care, folks. Now I'm gonna sit here, leave the show on for a couple seconds to see if anybody has any comments, things they want me to attach to the show or not. So it's open for everybody's discussion or chats with me. What do you guys think of the Medicare plan to do prior authorizations for certain procedures? But if it's going to delay treatment or if it won't affect it at all. I want to see what people think. So there's your question for you guys.